Hi, my name is Dr. Harsh Kapoor. I am a gastroenterologist and hepatologist at Primus Super Specialty Hospital at Chennai, New Delhi. I'm a chairman of Institute of Digestive and Hepatobiliary Sciences. And today I am going to update you regarding the hepatitis C. Basically, when you look at the chronic liver disease caused by the viruses, hepatitis B and C are the foremost ones. The other viral infections are usually acute and self-limiting. Hepatitis C is caused by RNA virus, which if 100 people get infected today, out of those within 6 months, body will clear 20% of the patients and 80% will go into the chronic phase. It is a dormant disease. People usually do not get symptomatic when they are infected, and over years, around 10 years before the liver is damaged and becomes cirrhotic. The question then arises, how do we get hepatitis C? It's a blood-borne disease. Usually people before 2000 who received blood transfusions could have gotten infected by hepatitis C virus, because prior to that we only knew hepatitis A and B. Any other infection not fitting into that was called non-A, non-B. And after 2000, when we had a test, and WHO and Red Cross, they applied this test to all the blood transfusion patients, we found that the previous to that, all non-A, non-B patients were actually hepatitis C patients. So people getting infected through drug abuse, people sharing needles, through razors, through contact coming in, people who have cuts and they are Hep C positive, sharing items like razors, toothbrush, the newborns infected through their mother who were Hep C positive. Sexual transmission in hepatitis C is very low, but not zero. It's stated to be between 0 and 8%. You can live with the patients of hepatitis C without any problem if you take care of above mentioned risks. It is important that we recognize these patients who are floating in the society without being symptomatic and can be potential transmitter of the disease, and their own livers can be destroyed over a long period of time, but when they become symptomatic, it is usually late. And especially this is a disease which we can cure with high success. We should be screening these high-risk patients and diagnosing them prior to the liver damage. Now, who are the patients who are at risk to get hepatitis C? One should look for the infants born to infected mothers, sexual partners. Even though I have said the risk is not high, and we have seen patients who are living with their partners for over 25 years, one being positive and other not positive, but this is mainly in monogamous relationship patients. Patient using IV drugs, patients who are infected with other chronic liver disease are at high risk, hemodialysis patients, and other patients with clotting disorders who are receiving blood products on frequent basis. Health risk patients and sex industry workers are at high risk. Now, a lot of patients will ask, how would I know that I have hepatitis C? And my answers to primary care doctors is that taking a good history of all of your patients, and during that incorporating few questions about risks can probably effectively tell us who are the people at risk so that we can screen. As I mentioned before, that most of the patient will be asymptomatic from liver point of view. Very few people will have acute phase symptoms of jaundice, and those patients are easy to recognize if they have come in contact with somebody or received a needle prick by chance of the patient positive status. When they do get symptomatic, they get nausea, vomiting, low-grade fever, and jaundice, but hepatitis C is not very commonly seen to be in acute phase symptomatic. So if we know that this is a preventable transmission, what precautions we should take? Well, first of all, with the westernized society we are becoming in, we should have safer sex, avoid sharing needles, toothbrush, razors of the patients. Healthcare workers who are at high risk should be screened from time to time, and they should also be screened for the other diseases which can concomitantly present in these patients. A frequent screening of hemodialysis patients, and children born to Hep C, Hep B positive mothers should be at least vaccinated for hepatitis B, although for hepatitis C we don't have vaccination as yet. Patients usually ask me that can I get any protection against hepatitis C? The answer is you do have vaccination for B, not for C. But if you take above mentioned precautions, you can avoid contracting hepatitis C infection. Now, if a patient has been infected, can I cure him? The answer is yes and no. As we know that hepatitis C is of 6 varieties, it all depends the success, which genotype of hepatitis C we have. If we club these 1 to 6 in a couple of groups, 1 and 4 and 6, they behave in a similar pattern. 2 and 3, they can be clubbed together for similarity in their course. Hepatitis genotype 1-4 is difficult to treat and has a prolonged period of 1-year treatment with conventional drugs, and for 2 and 3 for 6 months with conventional drugs. Recently in the market, other than PEG interferon, ribavirin, we have some new DDAs and other antiviral drugs come, which has shortened the course of therapy and improved the sustained viral response, the term which we use for cure at present. Normally, with conventional drugs for genotype 1 and 4, we treat for 48 weeks, and for genotype 2 and 3, we treat for 6 months. With these drugs, neo drugs, we can have a treatment shortened to between 12 to 24 weeks, and even nowadays we have option of interferon-free regimes. As interferon and ribavirin has some side effects, the compliance is low. With neo drugs, I think we will be able to get rid of those side effects, and the compliance will become also much better. But it comes at a cost. At present in India, it is not possible to get drugs, the course of which is going to cost $80,000. But we hope that very soon we will have, according to the need of the society, same drugs at a cheaper price in India. If you have one problem, then you should not be looking for second. With that, I mean to say, if somebody has chronic liver disease with hepatitis C, they should be making sure that they don't have any other cause of damage to the liver like alcohol and drugs. They should be completely prohibiting that, vaccinated against other viral infections. Now, the society usually asks this question, whether infected patients should be prevented from doing certain jobs and certain position they should be holding on. And the answer is no. These patients can very well do normal jobs, normal professions, just taking the precautions which we have mentioned, to an extent that they can even be cooks and cooking food without any trouble. The person should not be excluded from any of the works, and there is no evidence that the transmission can be due to their profession, so far as they are taking the precautions.